And thank you for joining us this Thursday for our press briefing. Today, Orange County Mayor Jerry Demings will discuss CARES Act funding, the current work of our strike teams, positive cases, and a word on the extension of the census deadline and many, many more details. Orlando Mayor Buddy Dyer will also discuss pandemic precautions in the city of Orlando, as well as business assistance programs and the campaign to combat domestic violence. From the Florida Department of Health here in Orange County, Chief Epidemiologist Alvina Chu will discuss super spreader concerns, mosquito precautions, and the ever-important Breast Cancer Awareness Month. And His Honor, Chief Judge Don Myers of the Ninth Judicial Circuit is also here to discuss plans regarding the resumption of jury trial work and an update on eviction moratoriums. We begin this press event this Thursday with Mayor Demings. Mayor.
All right, good afternoon to all of you. Welcome. We do have a number of additional persons who are here. We have Mr. Scott Howard from the school district who is here, who when we get to later in the press event, if you have questions of the district, he'll be able to answer those. And we're honored to have the Chief Judge here today. And as always, we have Mayor Dyer and Ms. Chu from the Orange County Health Department. And so I'm going to start today by talking a little bit about evictions and the eviction moratorium and the governor's order. Yesterday, Governor DeSantis declared that his local executive order or his state executive order limiting evictions and foreclosures is expiring. And this was done in an effort to avoid confusion to have Florida follow the CDC's national order to halt COVID-related evictions through the end of the year. Community Legal Services of Mid-Florida has told us that residents must be proactive and you don't automatically qualify for CDC moratorium unless you file the necessary documents with your landlord and the courts if you have a case pending. Questions and resources can be found at ocfl.net/housing FAQs. Also, remember, just because there's a moratorium does not mean that you are not responsible for paying your rent. You still have that responsibility. This makes our COVID-19 eviction diversion program even more critical. Since we launched the program a little more than a month ago, we have approved over $500,000 in payments that will allow 192 families to stay in their homes and avoid eviction. You can get information on our eviction diversion program, again, at ocfl.net/eviction diversion. Last night, the governor's executive order also provided direction to local governments as they move into transitioning from virtual meetings to in-person meetings beginning November the 1st. And this is Executive Order 20-246. We are exploring here in Orange County holding hybrid meetings to ensure the safety of all participants. Earlier this week, it was announced that there has been 1 million confirmed COVID-19 deaths worldwide. That impact is felt here in Orange County as we have now lost 470 residents to the virus. That's an increase of 12 since yesterday. All of these people who were lost are collectively mourned by their families, friends, and our community. Since the beginning of the pandemic, Orange County has had a total of 40,485 COVID-19 cases. Our 2-week average is 4.4%. Our average since the beginning of the pandemic in March is now 11.4%. And although our positivity rate remains low, you're going to hear from epidemiologist Alvina Chu from the health department who will talk about super spreader concerns and other concerns regarding demographics associated with youth here in our community. Ms. Chu typically works behind the scenes studying the data along with Dr. Pino, but she is well qualified to provide input today. Now let me talk a little bit about some of the hardships and the benefit of our CARES Act funding. I know that we are all experiencing some stress, some more than others, but the recent announcement by Disney of thousands of permanent layoffs in our community, no doubt, will accentuate the needs for crisis assistance for families and individuals right here in our community. Our local CARES money is in the community making a difference to help those in need. There's a slide that's up behind me that so far you can see that $243.2 million was provided to the county for CARES Act dollars, and we have expended $187.2 million to address the issues here within our community. These dollars are provided through our small business grants, social services, and community assistance programs, and to purchase personal protective equipment and other needs. This leaves the county with roughly $56 million to still allocate before the December the 30th deadline. With the need being so great, I want to let you know that we intend to announce the reopening of our Orange Cares Individuals Family Assistance Program early next week for a second round of assistance. So far, the program has helped nearly 30,000 residents and has paid out nearly $30 million. We know the need is great, and we intend to continue to answer the call for service in our community. Together, we see through to a promising future, and we want our citizens to stay safe and stronger together. In terms of our compliance teams, our strike teams, with the governor's Phase 3 announcement, business owners have been put in a precarious situation. Just because you can open at full capacity doesn't mean it is safe to do so, or that your employees or patrons feel safe. They must be careful because we are not back to normal yet. So we are imploring our businesses to be careful as you make decisions regarding reopening. Businesses are now responsible for enforcing their own CDC rules and guidelines, including social distancing, to keep their employees and their customers safe. To all of our businesses, please know that our strike teams or compliance teams are here to be helpful to you so that you can remain open safely. To facilitate this, our strike teams provide assistance, guidance, and resources such as personal protective equipment, posters, as well as encouragement to those businesses. If businesses call our 311 line, we can assign a team to come to your business and provide you with guidance and assistance as needed. Again, our local face covering order is still in effect. Since we began, we have visited well over 2,700 businesses, and compliance rates remain high, upward of 95%. So I say thank you to our businesses for cooperating during this pandemic. Let me talk a little bit about testing. As always, Orange County Health Services has consistently offered free COVID-19 testing throughout Orange County, and we're going to continue to do that next week. Next Tuesday, Orange County Health Services will be at the Mexican Consulate. Anyone desiring to be tested can go to their location at 2550 Technology Drive in Orlando. And on Wednesday and Thursday, Orange County Health Services will be in the Apopka area at Kelly Park from the hours of 8 a.m. to 1 p.m. All those 12 to 17 years old can be tested with parental approval, as well as any other adults, walk-ups included. Appointments are encouraged and can be made at ocfl.net/testing. Today marks the National Domestic Violence Awareness Month beginning. This morning, Mayor Dyer and I and others attended a press conference hosted by Harbor House at the Orlando Police Department. This is why I'm wearing purple today and the Harbor House facial covering to honor the victims and survivors of domestic violence here within our community. For more details about the work of the current Domestic Violence Commission, there's a webpage that you can visit at ocfl.net/DVC for more information. And I know, Mayor Dyer, you'll probably talk a little bit about our efforts with domestic violence awareness as well. In closing, I'd like to remind everyone that the census deadline, which was supposed to be the 30th, yesterday, has been extended to Monday, October the 5th. The Census Bureau is making a hard and final push this weekend to get into areas where they've experienced a low response rate. Some of the areas, this is not meant to be all inclusive, but to give you an idea, we have areas such as in the university area around the Alafaya Road area where the numbers remain low. The Wedgefield area, we have areas around Tangelo Park, Holden Heights, just to give you an idea of some of the areas where we have low numbers. We are working with the Census Bureau to get census enumerators or takers, surveyors, who will be in these areas and others during this weekend. So you'll see them out trying to assist with getting the numbers up. And at this time, I'm going to turn it over to Mayor Buddy Dyer.
Thank you, Mayor Demings. As a new month begins, I want to thank everyone who continues to do their part in protecting our community during this global pandemic. Together, wearing our masks, washing our hands, social distancing, we can control the impact of the virus. By continuing to take pandemic precautions, we can keep protecting ourselves, our loved ones, and everybody who calls our city home. Just as important as our physical health during this time is our need to take care of our mental health. I want to remind everybody about the resources that Heart of Florida United Way has. You can call 211 for information and support, for crisis support, financial assistance, health programs, and much more. So I encourage you, if you have those needs, to make that call. Mayor Demings mentioned that it is Domestic Violence Awareness Month, and I want to remind people in need that there is help out there. Harbor House has services to support survivors, and they can be found at harborhouseflorida.com. At this Monday City Council meeting, there'll be 2 items going for approval that are part of our COVID-19 relief efforts to help our small businesses. First, the Downtown CRA's Small Business Assistance Program will provide downtown retail and consumer service businesses with a rent subsidy of up to $5,000 a month for up to 6 months. Downtown businesses have been especially impacted by the pandemic because of the lack of a daytime workforce. Everybody's working remotely, and cancellation of events and lengthy closure of our nighttime economy businesses. It's our hope that this program will help them weather the storm. Once approved, by City Council, businesses within the Downtown CRA will be given notice of when the applications will be open. We also want to continue to provide relief to our 10 Main Street districts and their businesses as well. Monday, we'll consider an item to reduce the match that our districts must fundraise for the year ahead, with small businesses being the background of our local economy. These efforts are so important. I also want to remind everybody about the census. All of our funding formulas, all of our federal funding formulas, and a lot of the state funding formulas are dependent on that census count. So we want to have everybody that we can counted. And then lastly, we continue our testing efforts. Next Wednesday, October 7th, from 9 to 1, will be at the Englewood Center, and you can still make reservations at orlando.gov/COVID-19. Ms. Chu?
Thank you, Mayor Dyer. As Mayor Demings previously had mentioned, we've had 40,485 positive cases. That's total Florida and non-Florida residents. And the age range was from 0 to 106, and we've unfortunately had 470 deaths. Since the last time we were here on Monday, there have unfortunately been 27 deaths reported to us. The dates of the deaths actually range from July to present day, so this large number of cases reported to us does not necessarily reflect a substantial increase in the number of deaths currently. Out of the 27 deaths, about half of them, so 14 of the 27, were deaths that have been reported within long-term care facility residential homes. We want to express our sincerest condolences for the families and the loved ones of those who have left us. As I had previously talked about before, about multi-generational transmission, so essentially transmission within households between, children, parents, and grandparents. Over the last several days, and specifically, the most newest cases are occurring in those persons who are younger, so in the age groups between 15 and 35. And so we had these concerns about children or young adults who are out and about, gathering together and spreading the virus, getting the virus, and then also potentially spreading it to those within their household. We have, over the course of many investigations, several thousands and thousands at this point, have identified sort of the opposite. So multi-generational can go both ways. I just wanted to give some sort of real-life examples about what we've seen from some of the investigations that we've gathered recently. So there have been large gatherings of persons, say, within community groups or several households. One example is a surprise party that happened that involved 13 families across several different communities. They came together. Mostly it was adults who came to celebrate a special event. And then one person who attended was positive. Didn't know it, but was sick. And so one thing I want to emphasize with the pandemic precautions that we keep emphasizing is if you are sick, please do not go out. Stay at home and isolate. And so remove yourself or separate yourselves from other persons. So the party members, pretty much every household experienced a positive. So persons who were sick tested positive, and then persons who were within their households who did not attend the party, such as children, then became sick and positive. There were some asymptomatics. And so, some of these children were in face-to-face school, and some of these were launch ed or virtual only. And so this multi-generational transmission happens both ways. Another type of event, so I don't want to specifically call out or name out any specific types of events. We've seen many of these different kinds of scenarios, but essentially community gatherings, persons who don't cohort together or who live together, who come together and have, say, a common meal with lots of shared items, which is served, say, buffet style or not plated. And then also singing and perhaps shouting or gathering together. And so you could see that these types of behaviors sort of increase your risk. So super spreader events, I know is a very catchy term, but there's a range of events. I mean, I like a party as much as the next person, but there's a range of events, some less risky than others. And so if you look at the spectrum, the pandemic precautions that we advocate for individuals, there's also precautions that we advocate for groups in our community. So the less risky types of events would be things where virtual we'd say the least risky, where you gather together and maybe have like a virtual communal dinner. I'm thinking about the holidays coming up. There's several holidays that we're in right now. And there's upcoming holidays where typically we gather together, we drink, we eat. There's perhaps shouting, say if you're watching sports games, depending on which team is winning. But all of these are generally unmasked, and we're usually really close together. And I know everyone wants to be with their loved ones close together, but when you're planning these types of events, we'd like to emphasize that you maintain the things that we continuously emphasize to help reduce the spread of the coronavirus, which is still here. The pandemic, the numbers are trending in a way that we like, which is decreasing, but not zero. So the virus is still here. There's still this opportunity to spread, and if we gather together in large groups, without wearing our mask or social distancing or not practicing good hand hygiene, then we can produce a super spreader event in such a way. I'd like to bring up the age chart, not the age chart, the ILI. This is week 40, and so for an epidemiologist, week 40 is significant. It is the right and the top, it's top right on your view. So we track influenza-like illness out of all the emergency departments in Orange County. And this is, we call this syndromic surveillance, and this is sort of one measure, surrogate measure for what flu season looks like. So week 40 in an epidemiologist's world is the start of flu season. It officially goes, surveillance officially goes from week 40 to week 20 into April. So you could see here over the past several days and weeks, a increase in influenza-like illness activity. And so this is potentially a harbinger of the start of our flu season or circulating flu virus or other respiratory viruses, such as COVID, perhaps, in our community. And so I'd just like to bring that up. And related to that, so one of the best ways to prevent getting the flu is to get the flu shot. And so we have an upcoming flu shot event on October 17th. It will be at Freedom High School. It's on a Saturday. Hours are approximately, will be in the 9 to 3 range. I think we will send out a press release and a publication and flyers, and you'll hear something about it on the news, hopefully the radio also, about the flu shot. And it's free for, there's no registration, and it's first come, first served while supplies last. And the ages, we can give vaccine to children 6 months and up, and to adults. Masks are required because we want to, practice good pandemic precautions and help prevent the spread of respiratory illnesses, not just COVID. So all the things that we talk about that works for COVID also works for influenza. As Mayor Demings had mentioned, we have seen with there's been a lot of rain lately, and so we have seen some increased activity of mosquito-borne illness, mosquito-borne viruses within Orange County. So we just wanted to put out a reminder to still protect yourself from mosquitoes, and remember to drain and cover. So essentially drain water from anything that can collect water. The mosquitoes that spread these mosquito-borne viruses can replicate or reproduce within very, very small puddles of water. So, bottle caps that you leave outside, maybe after having a beer, or any small, the water collection trays under flower pots. So if you should tip those upended so that they don't collect water, so that the mosquitoes can reproduce. Also protect boats and vehicles from rain with tarps. Empty and clean bird baths, and maintain swimming pools in good condition. So a well-maintained pool will not allow the mosquitoes to replicate, and thus the virus will decrease. We'd also like to mention about covering your skin with clothing or repellent to protect yourself from mosquito bites, which is how the viruses are transmitted from the mosquitoes to persons. So, and with that, I'd like to turn it over to Chief Judge Myers.
Thank you, Dr. Chu. Thank you, Mayor Demings, for the chance to come and address the progress in our court system here locally. The Ninth Circuit Court, as you know, has been operating in phase 1 of a 4-phase plan that's been outlined by the Florida Supreme Court for the majority of the pandemic. Under phase 1, access to the physical courthouse is restricted, and most of the work that's being conducted is being conducted remotely, with some hearings or trials being delayed or postponed. During this time, we are instructed that in-person contact in the courthouse is inadvisable, and we really only engage in in-person contact for essential hearings, due process hearings, where folks have rights that need to be protected and there are applicable time limits. On September the 21st, the court transitioned out of phase 1 and into phase 2 after meeting the benchmarks that the Florida Supreme Court had set for the court. Our operational plan for transitioning from phase 1 into phase 2 identifies some critical steps that are designed to ensure your safety if you are in our courthouses. And it specifically addresses things like the continuation of remote hearings. We want to continue to do as much work virtually as we can to protect the participants. The requirements for health and safety screenings, hygiene protocols and PPE, cleaning and disinfecting throughout the courthouse, and assisting vulnerable populations who need access to the courts during times like this. In Phase 2, access to the courthouse is still restricted, but less so. In-person contact is expanded, but still limited, and requires everybody to continue to take protective measures. As a result, the court continues to require temperature checks and health screening upon entry to the courthouse. We continue to require face masks for anyone, anywhere inside the courthouse. We continue to enforce social distancing guidelines to limit the number of people that are in the courthouse at any one time, to provide hand sanitizer stations throughout the courthouse, disinfect high-traffic areas and frequently touched surfaces, and continuing with deep cleaning after hours in those areas where we've had folks come in during the day. The exciting news for us is with this transition to Phase 2, we now have the opportunity to begin the transition into jury trial work. And we are very excited to have the chance to resume jury trials. This week, in fact, we began to mail out jury summonses for jurors who will be reporting to the court in late October. Jurors play a vital role in the administration of justice, and they really are the backbone of our judicial system. I know if you receive a summons that serving right now may feel just a little bit overwhelming, but I want to stress to our potential jurors that we are taking every precaution to safeguard your health and your well-being while you're in the courthouse. In addition to those standard protocols that we just mentioned, we are summonsing significantly less numbers of jurors at a time, and we've arranged with our jury room to be able to comply with all of the social distancing guidelines plus. We're also limiting the number of people inside of our courtrooms. We're providing personal sanitizers and specialized masks for jury panelists, as well as providing face shields and gloves for those that request them. If you have been impacted financially or suffered a hardship because of COVID-19, there is the ability for you to request an excusal or postponement from your jury service. Jurors directly impacted by the virus, experiencing symptoms or at high risk, may be eligible to be excused from their jury service. So I want to encourage you, please carefully review the jury summons that you receive in the mail. That may be a summons for a grand jury or for a jury to try cases. Review that summons. There's information there on those bases for excusal. In addition, on the circuit's website, which I'll give to you in just a moment, you'll find additional information that may be responsive to your questions. We are thrilled with this opportunity, but we take it seriously. We recognize that when we invite people to come into the courthouse, we take on a special responsibility. And I want you to know we've been very conscientious in consultation with our local health department, whose services we are very grateful for during this process. I also want to bring you just a brief update on evictions. You've heard the mayor speak a little bit about the eviction diversion program. The Centers for Disease Control and Prevention issued a nationwide residential eviction protection order on September the 4th, and it does not expire until the end of the year. So those protections continue to remain in force and effect. As the mayor described, there are some prerequisites to gaining the benefits of that moratorium and those protections. Governor DeSantis has made the decision to allow the statewide eviction and foreclosure moratorium order to expire. The encouraging news that I bring to you is that eviction filings in the 9th Judicial Circuit are down pretty dramatically. Here in Orange County, for the months of August and September, we're seeing a reduction that's in the 35 to 40% range of eviction filings. That's a very significant number. Somewhere typical around 1,100 or so a month. We're seeing just north of 650 a month right now. Now, I could speculate about the reasons why that is. I'm very encouraged by the eviction diversion program and the work that's being done by the county. It is a win-win for landlords and tenants during a very difficult financial time. What I do know is simply this, that the case filings are down. And that if you are a landlord or a tenant who is dealing with eviction issues, I would just encourage you to visit the county's website, make application, get involved in that program, and to see if you can qualify and take advantage of the benefits. We continue to do everything we can to provide access to justice while safeguarding the health and welfare of our community during this time. We appreciate your continued patience, and we appreciate your cooperation as we navigate the pandemic and work to restore our full court operations. This transition into jury work is one of the most significant for us. We can conduct hearings, and in fact, we just ran some numbers. Over the course of the pandemic in the circuit, we've now conducted nearly 70,000 electronic virtual hearings. Those are done remotely through video conference or telephone connections or some hybrid thereof. That's phenomenal, but we are also falling far behind when it comes to trying cases. 7 months now of time period that we need to get trials going. So we're endeavoring to push hard. I appreciate the work of our judges in doing that and appreciate the work of the community in working with us on it. For updates, we just encourage you to visit the circuit's website at ninthcircuit.org, and please follow us on Facebook or Twitter for the latest updates. Mayor, thank you very much.
All right, thank you, Judge. At this time, I want to do something. I want to make sure we acknowledge we have had, I don't know, 100, somewhere around that, press conferences. There's been quite a few. But our American Sign Language interpreters are always here, and I don't nearly recognize them as often as we should, but I want them to know, and I want the public to know, that we do appreciate the work that they do to ensure that we communicate effectively to our community. So with that, thank you all for the work that you're doing. And now we'll open it up for questions, and I recognize that Ms. Lauren Seabrook is not here today to ask the first question of Dr. Pino. So.
Eric Sandoval with News 6. My question is actually for Ms. Chu. We got some, you dodged me today, Mayor. We got some numbers from Miami earlier today showing that some of the deaths reported in that metro area related to COVID were delayed 33 days. And you come to us this afternoon and you are reporting at least one death that dated all the way back to July. Why is this backlog happening? Where is it happening? And how can it possibly give the Department of Health a clear picture of what exactly is happening?
So I don't exactly know is the answer, but we do try to work hard to confirm and investigate the deaths, and so we are working to figure out why. It wasn't, so out of the 27, it was single digits, dated back to July. Most of them are dated from August to September. So I just wanted you to know that we do follow up on these. I did want to emphasize while I had the soapbox about required reporting. So the governor and the Surgeon General did require that all COVID testing, positive and negative, is required to be reported to DOH, the local health department where you're located. And if it's not electronically reported, it requires someone to actively do that. And so we encourage people to actively do that. And so there is some delay that happens there. There is, I did want to mention also, the inherent time lag that happens from the time a person becomes exposed to the time they become sick, to the time they feel bad enough to perhaps go seek testing or go see a doctor. And so there is a time lag that happens. The incubation period is approximately 14 days. So you start off, if you're exposed at an event, 2 weeks later. I mean, that's already a delay of 2 weeks. And then maybe on the first couple of days, I've heard, I don't know how many times, I just thought it was allergies. You know, I had a stuffy nose. I always have a stuffy nose. I can't ever taste my food, and so this didn't seem weird to me. But so there's the several days until you feel like maybe, perhaps, I should get a test, or I don't feel that bad to go see a doctor, and then you wait longer, and then you feel sicker. And so there's could be it could be up to a couple of weeks. From the time they're exposed to the time you get a positive test. And so then for all of our hardworking contact tracers that we have employed to try to find and stop the spread of this, going back a ways to ask you, 2 weeks ago, where were you? Who did you expose? Did you go to X many grocery stores? Did you go to X many restaurants? And then collating that information is difficult. But so I don't exactly know the answer. Thank you.
Jeff Deal with WFTV, in for Lauren Seabrook today. This is for Judge Myers, actually. I wanted to see if you could kind of take us through the process of seating a jury in one of these high-profile cases that may be coming up, and what the process will be. How difficult will it be, and how different will it be than it would be before?
That's a great question. We have the benefit at this point of having observed some other circuits from around the state who have already begun to try cases in more rural areas or areas where the virus has not had such a significant impact. And we learned three primary things. We know that it's going to take longer, that it's going to take more people, and that it's going to take more space for us to prepare, move jurors around, get a trial ready to go, and to actually try it. And what we're envisioning as we embark on the process of resuming trials is to first try one case, to experience that inside of the Orange County Courthouse and then inside of the Osceola County Courthouse. We recognize that our building wasn't constructed or designed for virus-type implications, pandemic implications. So we envision calling a small number of jurors down to the courthouse that will move directly through security and into the jury assembly room in an expedited track so that nobody accumulates lines or backups. That group will be summoned to a courtroom on one of our lower floors inside the courthouse where they don't have to access elevators. They'll be able to move up through the escalator system to get to that space. We know that we can seat a reasonable number of jurors, 25 to 30, in a courtroom, safely socially distanced, wearing special masks that allow the lawyers and the clients to be able to see the facial expressions on jurors as they're asked questions. The jurors, after having gone through the voir dire or jury selection process, will be reduced down to the number of jurors necessary to try a case. And then we have outfitted one of our courtrooms in a special manner to facilitate social distancing inside the courtroom, which means the relocation of furniture, things as simple as removing all of those chairs in the jury box so that we can put 7 chairs safely socially distanced inside of there. And special arrangements made inside the courtroom to be able to try the case to the jurors there. And I expect maybe even having everybody else leave the courtroom while the jurors stay inside of that large space to be able to conduct their deliberations. It's a very intentional step-by-step process. Again, we've walked through this with the Department of Health representatives to ensure that at each step we've given consideration to the safety issues for both the jurors as well as the litigants, lawyers, and court personnel. We don't anticipate trying a high-profile case for some time. Part of that is just a space restriction for us. High-profile cases might be a capital murder case, for example, where 12 jurors would be required. We just simply don't have a physical space in the courthouse right now where that's feasible for us. So we'll go through this process. We'll do a debrief when we're done, and then we're going to gear up a couple more trials, make the improvements along the way, and at some point hope to be able to ramp up to where we can start to address the significant backlog of jury trials. Thank you.
Troy Campbell with News 6. This question is for both Mayor Dyer and Mayor Demings. What went through your mind? What were your feelings when you found out nearly 7,000 of your residents would be losing their jobs at Disney? And how did that affect your optimism for the theme park's recovery?
Well, for me, it was sad news because some of those individuals who were laid off, their friends, their family, their acquaintances, they're residents of our community. And so as such, what we have endeavored to do here is to try to make certain that we are providing the crisis assistance to fill the gap between the period of time that they find themselves perhaps unemployed and employed, or in some cases they may be underemployed. And so the CARES Act funding has assisted us in providing the help that the various individuals and families need throughout the county. You know, our funds are provided to our residents regardless of whether they live within the municipalities or they live within the unincorporated area. So you heard me say earlier, we intend to reallocate some dollars from the funds that we've received to provide additional assistance. We intend to make that announcement about the reallocation on Monday to hopefully provide some relief to those families. So when I got the phone call from Disney, it was a sobering phone call, but one that was not unexpected. And I say that because Disney is the largest single-site employer really in North America. And we know that our economy has not recovered, our tourism has not recovered, and we know that it's going to be some time before it does, because the sad reality is the pandemic is still alive in all of America, and it's really all of the world, and it's live here in our community. And it's going to be a period of time before there's a vaccination that's available or a cure. So we know that we're going to see new cases. But because over time we've seen ourselves kind of grow, I guess, frustrated, and sometimes a certain amount of apathy has crept in, and people want to relax and behave like there is a vaccination and that the virus is not here, and inadvertently that causes new cases to occur. So I know all of you are like us. You know, we're not talking about somebody we don't know. These are people we know in our community who are going to be impacted. These are businesses and companies and corporations that we deal with on a day-to-day basis that are being impacted. So I'm going to hope that we do get a vaccine sooner than later, and I'm going to hope also that we'll get additional dollars from our federal government to provide additional assistance as we're in this, I think, for the long haul. It's been 7 months, and there's no question that I think we may have 7 months more to go before we really begin to see the type of recovery that we're all looking forward to. Yeah. Right out.
And I would probably say a lot of the same things that Mayor Demings has just said. Empathy comes to mind as a feeling, but not just towards those employees, but employees that have been laid off at the airport, that have been laid off at restaurants, that have been laid off in movie theaters, in the Dr. Phillips Performing Arts Center, you know, all over our community. We have one of the highest unemployment rates, probably not just in the state, but just about anywhere. So we know that it's a long climb back out of this, but it's significant when you see the numbers all in one day. And I agree with Mayor Demings. When I got that call, it wasn't unexpected. We had seen the other theme parks similarly laying people off in hotel chains, so it was likely that that was going to occur. But the large number like that reemphasizes and should reemphasize to Congress that the American people need help with this. We need some financial assistance to deal with so many unemployed people, so many people that are out of work and can't put meals on the table. Every day there's a food distribution site somewhere in our community, and every time I go to one of the food distribution sites, there are hundreds of cars that are lined up that are, a lot of the people would never have thought they would ever be in a food distribution line, and here they are because they've been unemployed for 6 months. So, you know, we have real empathy there, and we don't know how long it's going to be till we can get back to normal or climb back to normal. But there's no question that the one single thing that every single person in this community can do to help us get back towards a new normal would be to wear a mask. And I don't know why that's a political discussion at this point. There's not a single medical professional that would tell you you don't need to wear a mask. In fact, a lot of medical professionals are telling you that a mask is better than a vaccine. We'll see about that, but wear your mask.
Hello, everyone. Deanna Albritton, Channel 9. This is a question for Dr. Chu. So there have been a couple articles over the last couple days talking about the impact of super spreaders, that 20 to 30% of people are responsible for about 70 to 80% of infections. And I was just wondering, is the health department, particularly going into flu season where people might be more confused about their symptoms and we might have more holiday gatherings, is the health department looking at any changes to contact tracing that might help better find those initial people who might have been responsible for more infections, rather than the way we kind of contact trace now with what you talked about with trying to figure out everyone they might have been exposed to?
Right. So I'm not a doctor, but thank you. So I just want to start off with that. But I have done this a long time. So as far as super spreader events, so let me go a little bit backwards to what you were talking about with sort of the process of how we do contact tracing. So we are focused now. So in our core, our COVID response center, which I invite you all to come to, just to meet with some of the contact tracers and have some conversations with them. We have a priority system set up where we try to filter out those group settings that are at the highest risk. And so we every day filter out, we're looking for everything in congregate settings like long-term care facilities separated out, and then schools, and then institutes of higher education or colleges and universities. And then we have our primary contact tracers delve into case investigations, which is trying to identify the super spreaders, or trying to identify the cases and where they might have been exposed to and how they might have gotten exposed. The biggest challenge is people don't pick up the phone or they hang up on us. So since I'm up here, please, it helps us reduce the spread if you can talk to us and help us identify where you potentially might have been exposed and how we can help prevent the spread in places where you might have been. So we are not a DOH, a regulatory agency necessarily, or punitive. And so we really just would like to understand more about the virus, how it's spreading in our communities, and ultimately, how can we prevent the spread. So as far as that's about the contact tracing and identifying the super spreaders. So I might have forgotten the other part of your question.
Just asking about, since there are so few people maybe having an outsized impact on the number of infections, is there a way to kind of better identify those people or where it started to get a better idea of where those infections might be instead of the people they've already spread it to?
Right. So there's still some research done. I think there's a lot of things we don't know necessarily about super spreader events. So it might apply to the person. So is there something about the person that maybe they create more or replicate more virus, or maybe they're able to shed it more? But our focus would be on prevention-wise. Our focus would be on the gatherings themselves. And so we've moved into another phase where people feel comfortable to collect together. And so there are several characteristics about these events that we would like to educate people about. And so the size of the gathering matters. Smaller groups has the smaller potential for spread. If you can social distance, that reduces the spread. We are not at zero, but our goal is to reduce as much as possible, to minimize. Hand washing, good hand washing, refraining from shared surfaces or utensils, and also and wearing a mask or facial covering if you are going to be within close distance of another person helps prevent or helps reduce the respiratory spread. And so that's the part I wanted to emphasize. All the super spreader events have the same kind of characteristic where you have large groups of people together doing behaviors that promote respiratory droplet spread.
This next question was texted in for you, Alvina Chu, from Nassim Miller from the Orlando Sentinel. Her question reads, do you think hospitalization numbers have leveled off in the county? And if so, what does that mean? Do you expect them to go up or down moving forward?
So we recently, moved into another phase where things are a little bit more open. It's a little early. So there was this inherent lag that I had just brought up about, the time that you're exposed to the time that you become symptomatic, to the time you might feel sick enough to be hospitalized, or to the time where, unfortunately, one might expire. And so I think the numbers are stable from what we had seen previously, and the expectation is as long as we continue to have these large kinds of events where there might be more spread, or persons whose behaviors do not help us prevent transmission or reduce transmission. I would expect some increase in hospitalizations, but we're watching.
Thank you. This next question was texted in from Mayor Dyer. This one comes from Ryan Lynch in the Orlando Business Journal. Mayor Dyer, with the rent subsidy in the downtown CRA, what other requirements will there be for companies applying? And is there a certain number of companies the city is looking to help?
We're looking to help as many as we possibly can. What was the first part of the question?
With the rent subsidy in the downtown CRA, what other requirements will there be for companies applying?
That you not have been behind in your rent for more than 90 days, and then that you're in the downtown business district.
Okay, thank you. These last two are for you, Mayor Demings. The first one comes from Asher Wildman with News 13. Mayor Demings, a business owner told me an Orange County task force team came into his business this week to check on social distancing and crowd size at his restaurant. However, what can the task force do? The business owner is taking the governor's phase 3 plan to heart and doesn't understand what it is your task force can do to him if he is violating a county mandate or order. Can local businesses be fined, and what is the task force currently doing, and for how much longer?
Okay, again, the compliance teams or the strike teams are going out to be proactive and to where they go in and review the business activities and determine that they're not consistent with the best practices recommended by the CDC. They simply inform the business that you're not complying with the CDC guidelines and here's what you can do. And also, if that non-compliance is because of a lack of understanding of what is in the CDC guidelines, they help to inform. If they need personal protective equipment, they will provide that. If they need other collateral materials to be able to better communicate, inform, that means signage or what have you, they're there to help provide that. I think that if we approach it from the perspective that they're not there to be punitive, they're there to be of assistance, that is the goal that we have in mind. In regards to are there penalties if a business is found to be non-compliant, in most cases there are not going to be enforcement penalties. However, there are some regulated businesses that, irrespective of where they find themselves today, they are required to have sanitary protocols in place, and the health department and other regulatory entities within the state still have that responsibility. Those same sanitation protocols that were in place pre-pandemic, they still exist today. You can't waive some of those things in terms of capacity, whether or not you're not adequately socially distancing or what have you. They're there to be of assistance to you. So that's it. That's what I would tell them. If you need information about our strike teams, obviously it's published on our website, and you can dial 311 if you're within Orange County. Just dial 311 like you would 211 or 411 or 911. You can just dial those 3 digits.
And lastly, from Steve Hudak with the Orlando Sentinel for you, Mayor Demings. His question reads, how much money will be available for round 2 of the individual and family assistance grants? Are previous recipients eligible?
We will make the announcement about how much money will be available at the beginning of next week, and we will announce the criteria by which individuals will be eligible. All right, with that, thank you all for being here. Hope you have a good, safe weekend as we still have a lot going on in our community as high school football and other professional sports are still on the way here in our community, and even collegiate football. So thank you all for being of assistance and in support of the efforts that we collectively have underway here within our county. Have a great day.